Today, we're going to be talking about value-based healthcare. Now, I was prefacing this with topic request literally came in on the topic request form, and I didn't know where it came from, so I wasn't able to ask a lot of questions. I kind of had to make some assumptions on what we might want to talk about in regards to value-based care. So, like I said, this is a very high-level primer 101 conversation. And if there are things that come out of this session that we want to dig deeper into, then we could do another call on those. What I identified was this is a really big topic. There's lots of components. So make sure you get your pencil ready to take notes. Make sure you get something to drink, that you're in a comfortable chair and ready to go. For anyone who's new and may not know who I am, my name is Nicole Broadhurst. I'm a former healthcare administrator turned independent patient advocate, founder and CEO of Tennessee Health Advocates, and creator of The Circle, where I help independent patient advocates create sustainable and profitable practices without the chaos of entrepreneurship. So, today we're going to talk about this whole healthcare, value-based healthcare. And as always, there are three things that I want to share with you today. One, I want to make sure that we talk about and have a basic understanding of the concept of value as it relates to value-based healthcare. I want to make sure that we talk about the importance of embracing preventative care and wellness initiatives as they relate to value-based healthcare. And then the third thing that I want to talk about is navigating the payment models and the quality metrics as they relate to value-based healthcare. Those are like three huge buckets of topics that we could talk about underneath value-based healthcare. But I figured that these would get us started on these conversations and maybe lead to some additional value that we can look at some additional sessions. So without any further ado, let's jump into this. The first thing that we want to talk about is understanding that concept of value. Okay. So, the core of value based healthcare focuses on delivering high quality care while optimizing expenses or reducing expenses or being efficient with expenses, right? I like to use the word good steward of resources when it comes to the financial aspect of that. So it's not just about cutting expenses, right? It's about cutting the expenses while we ensure that every healthcare dollar that's spent translates into improved patient outcomes. Okay? So that's the core of value-based healthcare. It's basing the expenses. You know what? I'm going to reference a really nice YouTube video from Eric Bricker. If you're not familiar with him, Healthcare AZ, I'm going to encourage you to go. He's real high level. Some of his stuff that gets very, very complex. But really, value-based healthcare is about finding the 50-50, the balance of optimizing clinical outcomes with the expenses, right? Like we're not spending too much to get the clinical we're not overspending to get the clinical outcomes, but where is that place where we can spend the appropriate amount of money and resources and get the optimal clinical outcomes? That's really what it's about. Okay. So as I'm thinking about this, when we talk about value, part of the problem with value is we'll get into this when we talk about the metrics, is how do you measure value? Because the truth is, if you ask me what's valuable and what value looks like, it'll be very different than what other people think. So let's kind of just think about it in that place of finding that balance, right? Where we optimize our expenses and get the best return on our investment. That's a good way to put that, I think. In this case, we're talking about financial investment into services rendered and the clinical outcomes as far as the return on our investment. So what can we do as advocates to kind of help our clients understand this concept and leverage it to get better clinical outcomes? And I think most of us do these things, right? So one of the things that we can do as advocates is we can make sure that our clients understand some of the quality measures that are already out there, right? So like CMS has a star system. And so understanding what that means as a patient helps patients become more empowered and educated consumers. Now, before we go any further, I want to clarify and I want to say a disclaimer about that. There are times when we can be very educated and empowered consumers of healthcare, and there are times when it's just important to save our life. And so the things that we're talking about here today are about those times when we have the luxury of doing some research, finding out what physician we want to use, what surgeon, what facility, what. So I just want to preface that none of what we're about to talk about is related to emergency services. Okay. So one of the things we can do is we can help our clients understand leapfrog measures. We can help them understand safety measures. We can help them understand the CMS STAR system in order for them to become educated and empowered consumers of healthcare, right? They can compare and look at the health systems in their area and decide, do I prefer ABC health system, or do I prefer XYZ health system in my community, and make that choice proactively, right? So we can do that. The second thing that we can do is as advocates to assist our clients with value-based healthcare is facilitating, and again, remember, I think that some of this comes innately to us, is facilitating that shared decision making with providers, right? It seems to be a buzzword, but really engaging with providers and having dialogue around choices, treatment options, benefits, pros and cons of those treatment benefits, and letting patients really get involved in the decision-making process. I think that this is increasing. We're seeing more and more patients willing to have those kinds of conversations, but there's still a lot of patients that need us as advocates to kind of help encourage them to do that and to become more of an active participant in their treatment planning. And then, of course, the other thing that we can do as advocates is we can advocate for transparent pricing and quality information, right? And kind of lean in on providers to make sure that they're providing both of those things to us so that we can assist our clients in making these decisions. So this would include things, and for me, I run against this a lot, where a provider may not publish of the prices that we expect them to be posting and providing to us. And so I might have to lean on them to get that information a little bit harder than maybe a patient might feel comfortable doing. You may also find this in some of your quality metrics. I don't navigate the clinical side. However, as a clinical advocate, I would assume that there are quality metrics that you like to see in regards to a surgeon, maybe, you know, how many never events are occurring in this particular facility? How many, you know, some of those quality metrics that they need to be providing, you know, we might need to ask a little bit, lean in on them a little bit more and get some of that information back, or help our clients ask those questions to get that information from them. So those are some things that we as advocates can do to help our clients better understand value-based care and leverage it to their advantage, right? Leverage it so that they have the information they need to make better choices for themselves. The thing that I wanted to talk about was the importance of embracing preventative care and wellness initiatives. Because all of this value-based care is about getting better clinical outcomes with less financial investment, it really puts a spotlight on preventative care and wellness. right? Which is one of the reasons that we see the ACA requirement that preventative services have a zero cost sharing responsibility, right? Is because patients, we want to encourage patients and consumers of healthcare to be actively participating in preventative care. So as advocates, our job becomes educating clients on the importance of that preventative care and helping them access it appropriately and without fear. Because what I hear a lot is, because they're from the financial side anyway, is that from the patient's perspective, there's a lot of coding errors in regards to preventative services, things that patients we believe are going to be billed as preventative, and then they turn out that they weren't preventative, they were diagnostic, and now I have to pay for them. And there's a lot of confusion around that. So take this opportunity to really help your client understand what those preventative services are. Maybe go pull the list from CMS so that you know exactly what tests, and they have it broken down on the CMS website, where you can pull preventative services for men, for women, for adults over this age, for children. Like, it's all out there. So you can go get it and help your clients understand that, yes, this should be covered under preventative services. And then if it's not, help them connect with an advocate. If it's outside of your wheelhouse, help them connect with somebody that can help them navigate those preventative service billing errors, because there are a lot of them, right? So educating your clients on the importance of preventative care. You can promote wellness programs and resources. I know there's a lot of advocates that are working with employers and kind of buckling in and bridging the gap and helping advocacy with wellness programs, right? And so if that's your wheelhouse and that's what you're doing, then help encourage your members or your employees or the people that the clients that you're serving, to make sure that they're accessing those wellness programs and those resources to help them stay as healthy as possible. Okay. And then in addition, we can, as advocates, always advocate for comprehensive health assessments and care plans. This is an area, care plans and assessments drive treatment, right? And so there's lots of times, I know for a fact that these can be very cumbersome pieces of work and time consuming, right, to create for each individual patient. And I was just in a webinar today where keywords for documentations and care plans are safe and effective. And these are keywords that need to be included in care plans and health assessments to help establish medical necessity. So as advocates, we can help our clients get value-based healthcare by helping their providers create and make those assessments and care plans, and just kind of help them use the words that establish the meaning that they're trying to set for these patients. Because I think a lot of times that can get convoluted through the process as well. So those are some things that we can do in regards to helping our clients leverage value-based healthcare and stay healthier and get the services that they need. All right, so those are all proactive measures and actions that we can take to help our clients. And then by doing that, we really contribute to improved health outcomes and reducing healthcare costs in the long term, which, as we talked about, is at the core of value-based healthcare, right? All right, so this third topic that I want to talk about is about navigating the payment models and the quality metrics. And I want to preface this by saying this is where things get really kind of messy. So value-based healthcare often involves alternative payment models, okay? Typical payment models are what we call fee-for-service. This is where a provider provides a service and then gets paid for that service. Okay, that's typical, that's pretty standard. So when we talk about alternative payment models in regards to value-based healthcare, we're talking about things like bundled payments. We're talking about accountable care organizations. I'm going to suggest that if you want to know more information, that you get really familiar with these payment models so that you can help your clients understand how they impact their care options and their financial responsibilities. Okay. We need to be knowledgeable about the quality metrics that are used to assess providers' performance, because that's a piece of the value-based payment model, is the provider's performance. And helping our clients choose providers with higher quality and cost-effective care. So when we talk about these payment models, again, we want to talk about the fee-for-service, which is provider provides a service, they get paid a fee. Pretty simple, right? Value-based models are bundled payments and or capitation. And these are where providers are reimbursed based on patient outcomes, or it might be a fixed fee per patient. I'm going to give you some examples. Bundled payments or capitation. You can look at home health care. Home health care has episodic payments. Okay, and so the payment that a home health care agency receives includes all services provided within a time frame. Okay, DRGs, same type of thing. It's interesting, as I was preparing for today's session, I wondered, as I was coming up with these examples of value-based payment models, I started to wonder, because DRGs have been around a really long time. Episodic payment in home health has been around a while. In fact, there's even a capitated payment model in skilled nursing facilities, right? And that's been around for a while. So it made me start wondering, wow, I wonder when value-based payment models actually started. The very first value-based payment model came from the patient-centered medical home, which was developed by the American Academy of Pediatrics in 1967. This payment model was actually created to help sick children who were seeing many disconnected specialists and needed care coordination. 1967. And so it's not new, right? It has been around for a while, and there are differing, this is right, there are differing thoughts on why it is not picking up more traction. And that's a separate conversation if we want to get into it. But I think it's really interesting because 1967 was a ways, it's been a minute. So anyway, so those are the different payment models, and understanding that if you're working with providers in regards to reimbursement or paying bills, that can get really important to understand the payment model that you're working under. The second part of the payment models have to do with quality metrics. Now, these are the things where you'll see CMS that has value-based reimbursement based on some of these things that are making a difference. And some of these quality metrics won't surprise you. There's lots of talk and discussion around them, right? Patient satisfaction. I mean, we have entire departments in hospitals now dedicated to the patient experience as a result of patient satisfaction driving value-based payment models. Patient safety. Okay, right? So again, it's a quality metric that is easy for providers to monitor and track. So patient safety is one of the quality metrics that can drive value-based reimbursement. Obviously, clinical outcomes. We see this specifically, the easiest place to see the clinical outcomes driving that is with the DRG 30-day readmission reduction, right? So hospitals get penalized if their patients are readmitted within 30 days under the same diagnosis. And yes, that only applies to certain diagnoses, but that is an example of how clinical outcomes are affecting value-based payment, right? Because if we didn't get them squared away and we discharge them home and they're back in the hospital for the very same thing within 30 days, that's a direct reflection on the clinical outcome. Okay. And then of course, advocates, what can we do? We can always, and I think this is just part of our nature and the work that we do, is we can always advocate for patient-centered care, right? Putting the patient in the center of the care, the treatment, and the treatment plan and the care plan and all of those things, making sure that we are prioritizing the patient's preferences, their needs, and their values, because ultimately the patient is who identifies and defines whether or not they got value from the service. So all of these things that we can do to empower our clients to navigate payment models, quality metrics with confidence, take advantage of wellness programs, and then of course just understanding what is at the core of value-based healthcare will be really helpful for our clients.